there. So I just wanted to hop on and show you guys a little bit of hip work, some sciatic work. I've got Drago here who's accompanying me for a little bit of calming therapy, just because he loves to do that. So I'm going to start with SI joint play. You might do this when there's lower back pain. My hand, the medial parts of my palm rather, are on one side of that diamond-shaped bone, the sacrum, and I'm pushing it down at a 45-degree angle towards the greater trochanter, towards the hip bone, or at a 45-degree angle going upwards, more towards the elbow. And I'm staying with the medial parts of my palm on the bone itself, just pulsating and stretching it away from, it's attached away from the other side of it. So I'll go ahead and do that twice. After the second time, I release the hand and the other hand's gonna go underneath. So we're gonna do some sciatic joint play. I'm gonna go up or down for pulsing 2, and on 3, that hand underneath is just sneaking under and lifting the hip up, having this separation happening to the SI joint. Go around the other side, and we'll do the other side. So now I'm working on the SI, on the sacrum, opposing myself, and my hand stays. It doesn't slip, but it does stretch and pulse for 2, and then lift on the hip for 3 as I release. So it's a 1, 2, pop 3, and the hand changes from going down to up. Afterwards, you can anchor and do spinal joint work, making sure your thumbs are touching each other and index are touching each other. So essentially it's like this, and just isolating the transverse process or the erector muscles on either side of the spine. And the bottom hand doesn't move at all, it just anchors and isolates so you can get that spinal joint play. After you've released the sacrum, you can also release it this way. Particularly good for booty butt, for people that have a really, not a kyphosis, sorry, a lordotic curve. So I'll just go ahead and depress that area. My other hand can be drawing towards myself for a little more traction. And you might just, as you're anchoring this, lean your body's weight forward into it. Essentially, my palm is pushing towards their toes. After I feel a stretch, I tip my fingers forward, but avoid touching the gluteal itself. From there, there's 3 points that the sciatica can be accessed through on the glute itself. Then there's another 3 points on the ankle, heel, and side of the Achilles, side of the ankle as well. So the 3 points here, I'll just start by ringing. Ringing is an excellent technique to lift the muscle off of the bone, give a little twist, and offer it some length in a relaxing manner. And once you've gotten comfortable with it, you can stay in the areas that are sticky and not moving, and just encourage that movement. It helps to move your body in opposition and to be on the balls of your feet and allow your heels to kind of lift your hips up. A little bit of dancing. The more you kind of have a yoga dance and fluidity, the more they'll relax. So the 3 points, if I can show, this is the sacrum here, and there's the greater trochanter, the hip bone. So those 3 points are like a happy face. Just above the hip bone, so you don't want to push on the bone, but just above it. Here you're going to dolphin dive in and up, so I'm going to push down first. And if you don't get to push down, come inwards more towards the cleft of the buttocks. Once you sink into that dolphin dive, just pulsate. Try not to be poignanty with your fingers, but rather lean your body into it, keeping your elbows locked. That way the transfer of energy is direct and unencumbered. As you soften and come out of that point, you can soothe that area with that ringing technique. Maybe you can see it a little bit better here, hey? Picking it up, twisting, and letting it go. Pick it up, twist, and let it go. Essentially, the ringing is pushing the TFLs and the adductors inwards. Abductors inwards. And on the bottom, all around the hip bone, the glute max, glute medius, and the piriformis muscles attachments to that hip bone. You're wanting in that pelvis to loosen that up. So what you want to try not to do is to separate the cleft, separating the butt cheeks. Might encourage farting and other unpleasant sensations. Just might feel a little bit invasive. So don't spread the butt cheeks, but push in. So essentially you're pushing in and lifting the muscles, attachments, and lengthening the tendons around the sacrum and that hip bone. So the 3 points, that was the first one, dolphin diving in off the side of the greater trochanter, that hip bone. 45-degree angle from the top of the hip, top of the iliac crest. I'm going to go on a 45-degree angle and push in straight towards the midline. And I can pulsate with my body for 3. Relax your shoulders back and down. Make sure that you're not protruding and tipping one way or the other. As you ease off of it, ease off with your body's weight, soothe the area. And come to that 3rd point, which is the sacrum. So pull away from the sacrum, have a little bit of a taut tissue by pulling an inch or 2 away without any oil. So we're not gliding, we're just stretching the top tissues. And then sink through that top tissue, through the skin, through the adipose tissue, through the lymphatic tissue, into the muscles tissue. As you're sinking here, you're sinking into well, the gluteus maximus, the piriformis attachment here, sacrum. What else attaches to the sacrum, hey? Well, to the iliac crest, which is close to here. We're going to go into a whole anatomy. Well, I was just thinking about the QLs really quickly, quadratus lumborum, and how it attaches to the hip bone and the lowest of the ribs, and the 4 lower transverse processes of the lower dotic vertebrae. So essentially you want to loosen those areas up. The tendons attach a muscle to a bone, and the more you wring that tautness out and offer length to it, the more you're inviting it to relax, lengthen, and hold a new length. So if you notice that one hip after you've done that is higher than the other hip, then that's the side that you might depress and give it a stretch. So I can just lean into a quarter panel of the glute max in the middle of the bubbliest part of the butt. And then just with my palm, so again, not protruding with any bony prominences or digits. And then just rock into it so it's non-invasive. If you ever feel them clenching, ease off a little bit. Sciatica is the longest nerve in the body. So if it lights up, it's like an electrical nerve. So it might be very sensitive, and if it's hypersensitive, it might be better to do almost more energetic work on it, and then a few reflex points. So figuring out which of those points are not sensitive and then working on those. So really quickly, some sciatic points other than those 3 areas is where the hamstring inserts into the buttocks. So if you take the butt itself and you visualize it as a quarter, go halfway and another half of that half. And where the bubble starts to occur on the butt is the attachment of the hamstrings. So I'm going to go ahead and push into the hamstrings at the back of the leg, close to where the bubbling occurs, and push straight up and into that outer quarter. I don't know if you can see that really well, but the outer quarter essentially of the bottom of the butt, near the sits bone. Yeah. And then you can ease off of that point. You might do that 3 times. You can offer a little bit of wringing to the hamstrings themselves. And then I'm going to show these sciatic points themselves on the ankle. So, the Achilles tendon, let's go ahead and expose the foot. Well, that's okay, we've got socks on, but that's fine. So here's the bone itself of the ankle. I might just pull it down for, that's okay. So right on the outside of the malleoli, your ankle bone, the lateral aspect, lateral means on the outside, so on the outside of the ankle, there's a letter J, where you can contour the outside ankle. And visualize as you're pulsating and pushing in that you're making the letter J. You might also visualize that you're relaxing the lower back, the hips, and the sciatic nerve. The longest nerve in the body starts at the sciatic or at the SI joint, and it goes all the way to the bottom of the foot here. So the second sciatic point is, if you're visualizing the heel itself as a clock, it's at the outside of the clock, either at 4:30 or 7:30. You're using your knuckle, so it's on the outside of the foot, depending on what foot you're on, it'll be the outside. Here it'll be 3:30, and here it'll be 7:30. I got that time wrong the first one. So 7:30, we're pushing in with our knuckles straight in, about an inch in from the outside of the foot. If you're looking at it like a clock, I'm at about 7:30. And if I go to this side, I would be at about, no, it is 4:30. And I'm pushing straight in. That's actually where the nerve ends, at the bottom of the outside of the heel. And it's such tough tissue that you need a knuckle to push in. I wouldn't have enough strength with my thumb, and it wouldn't be good for me as a practitioner, even if I did, to use it. The last point for sciatic that's really good, that's non-invasive and it's not a tender spot, is the Achilles itself. So for 4 from the top of the malleoli, roll inwards on the Achilles and pincer grasp, squeeze tighter, and relax. And we'll do 4 zones with pressure that's progressive and relaxing. As we go all the way up that 4th zone, and as you're coming down it, this whole area in reflexology is known to be effective, or has been known to be effective, with relaxing lower back, hips, rectum, and lower digestion, and sciatica. All right, so that was 1 point for sciaticas, releasing the Achilles tendon. You could also espow the Achilles tendon, so grab the tendon and stretch it one way and the other, just to kind of increase circulation to that area and loosen it up. That second point was the letter J, of pushing and pulsating around the outside of the ankle. So the sciatic point is around the outside of the ankle, and making the letter J. And you might do that 3 times, pulsating for a few seconds at each point. The third point was using your knuckle on the outside of the heel, 1 inch from the outside. And you're using your knuckle, and you might use this hand as resistance, pushing and drawing it in, like getting a knuckle sandwich. This is actually where the nerve ends. So when you're releasing this, you're helping to quieten the whole nerve. Other nerve techniques that are really wonderful is tapoma on the nerve. So you can wake up the nerve. This is more for a deadened nerve. So if you have a neuropathy that's like a Bell's palsy on the face, excellent to do that too, to stimulate the nerve. But if the nerve's lit up, you could do nerve stroking, which is a reflex technique. It's an automatic technique to create relaxation on the nerve. Other things for sciatica is looking at, other than loosening up the SI joint, loosening up the glutes themselves, and working through releasing sciatic reflex points in the heel, ankle, and Achilles, is to do stretches to separate the SI joint and loosen it up. Often you see it with a lower lordotic curve. So if somebody has a really big arch, there's a lot of compression there, and that's where that tractioning can be really great. So home care, they can hang upside down or on a table or inversion to get that stretch. And they can also make the number 4 the same height as their hip, lying down, so they're not engaging any muscles. And then they're going to use their opposite hand and draw that hip toward themselves as their opposite hand looks away from them. And once you can, relax a little bit more into that and open up that stretch a little bit deeper. So that's a really nice spinal twist that'll loosen up the TFLs, the tensor fascia lata, the glute medius itself, your adductors, hey, that are turning the hip into the midline. So that's, yeah, I hope that's helpful. It's a little bit about how to loosen up the hips itself. The SI joint play is a really great technique. That's the first one that we did. That was 1, 2, pop 3. Yeah, practice that one a lot, get comfortable with it. Everybody loves it once you find your rhythm with it. Wringing of the glutes, great technique to relax the glutes themselves. You can get into origin and insertion work with GTO release, which is one of my favorites. Actually, I'll show that in 2 seconds here. Well, I could do it to the hips. I was going to say I'll do it to the ankle so you can see that technique easier, but I'll do it to the hips first since this was about hips. So I'm just going to go ahead and draw the linens down to just above the cleft of the butt so that you can see the SI joint itself. His isn't very defined, but just so we can show skin rolling on it and loosening it up. So I might start above it, and skin rolling is just lifting the skin up to release adhesions in the fascia. So my thumb is constantly pushing forward and my fingers are inchworming. As I do this, it's without oils so that I can strip the fascia. You might do it 3 or 4 times. Where it doesn't skin roll, where it doesn't lift up, change directions and work that a little bit more. See if you can open that up. And then there you go. Once you get the movement in it, you know that you've loosened up the fascia in that area so that you can get maybe deeper into the tissues and their holding pattern might hold a little bit more open. So 3 points is sciatic. We can do them from above together by pushing down and in and in on the corner panel, 45-degree towards the cleft of the butt, and then around the hip bone is that 3rd one. And again, if they're clenching, ease off a little bit and go into it gingerly. Try and use your finger pads and fingers rather than digits. You can also use your palms, that's lovely. And once you get into there and they're comfortable with what you're doing, instead of so much manipulation, I would just get in and hold. And that's that GTO release, is hold near the tendon and just move the way the tendon moves initially. So I'm going inwards with both palms towards the SI, and then I can go the opposite away. I might just lean into it for a minute or 2, really opening up. Let your body's weight and your breath open it up. So GTO release is Golgi tendon organ release. It's used in a lot of Asian work uses it, like Thai yoga and different Asian work I've noticed. So if I was to show it on the ankle just really quickly, it's holding the tendon and then torquing it, essentially like that S bowing and C bowing, sorry. So it can be really tender. And I don't want to make it tender, so I'll just ease off to their comfort level of what they can breathe through. And then just soothe that area out. All right, so again, just give the hip a good stretch at the end. I'm going to go ahead and just draw down on the ankle. And as I do that and lean back, I'm getting that hip stretch. So the left hip, you can watch it from the top of the glute there as I draw back. It just lengthens helping to lengthen the hamstring, the Achilles tendon, the lower back, quadratus lumborum. The glutes themselves can give. You can stay like this for at least half a minute at the end. A long reset is a great way to encourage and maintain a new length. So we're looking at holding symmetry. Nobody's really holding symmetry all the time unless you're some Buddha guru yogini that's life path is doing this every day. Anyways, that was Sciatic 101, a little bit of hip work. Hope it was helpful. If you have any questions, send us a comment. Trying to look for where the stopper is. Got it. All right, take care, guys. Be well.